my 11-year-old Vivi and my 13-year-old Elodie, saying, look what children are doing. I love your idea of having a cot for children. So I've been thinking a lot about the fact that at the end of the day, this is about power. I'm an emergency physician in the subarctic in Canada, so I take care of a population of majority Indigenous people who live north of where most people live. So in some of those cases, they're dealing with temperatures that are over 3 degrees Celsius warmer than they were when an 80-year-old elder was born. I just came from a session dealing with the mental health impacts on Inuit youth. So permafrost is melting, landslides are happening, it's changing the landscape, it's more difficult to hunt on ice that's no longer stable, that has food security challenges, really changes in the culture as well as a sense of purpose of people there, which is very, very difficult. My 100-bed subarctic hospital was actually evacuated due to wildfires. That took an entire national military operation to evacuate our 100-bed hospital down to British Columbia. We thank everybody in Canada who has helped us. But to me, this is an example of you can't throw enough money at this problem from an adaptation perspective to make up for a lack of mitigation. So I'm 100% dedicated to adapting health systems to wildfires, but we can't take our eye off what we've also said, that fossil fuels are killing us. Our friend Ed Maybach, who is a communication scientist, said they lie, we die. So at the end of the day, this is a power problem. And when we think about how we muster enough political power to win the arguments we need to win and to win people's hearts, I think we need to be thinking about our story, and I think our story is starting to line up. So we passed the UN Pact for the Future just recently. So now we have a through line, we have a North Star, we know where we're going. We are going towards a place that has long-term well-being for all. And if we start to build well-being from the children, making sure the children are taken care of by the adults who have committed to take care of them, making sure they have a house, making sure they have food, and we make sure that we're building our houses in a way that is healthy for us as well, our health systems in a way that honors health. When we were doing this mental health conversation earlier, I've been trained as a physician when people come in and tell me that they have suicidal ideation because their homes are melting in the Arctic. We're taught to ask people, okay, so are you going to commit suicide? What is your plan? What I've learned from Indigenous healers where I lived, and a healer, Besha Blondin, what she says, what she's been taught in her learning tradition is what do you still have left to do in the world? What is your purpose? What does your family still need you to accomplish? That strengths-based approach calls to the well-being in all of us, calls to the purpose in all of us. So if we adopt that in our health systems as well, pull that into our policy at the national level, Canada has created a well-being, quality of life approach that we can use to start to incorporate into budgeting, really looking for long-term well-being for all in our policies as well, integrating a planetary health lens into all of it so we de-silo at the ministerial level, so we're not bouncing back and forth between the ministries of health and the environment anymore. It's all integrated, and we're all pointing at this place that I think we've already agreed that we want to go. We need to start using those words around well-being, around happiness. I think that calls to the best in us. It helps us to remember why we're all here. So we know that based on the well-being literature, mental health is one of the major components. Physical health is one of the major components. So as we think about how we're going to line up everything that we need from the personal level to the policy level, let's think about what we all want. We all want to take care of our kids. We know that communication studies say that taking care of the next generation, love for the next generation, is what we are all most motivated to provide. Let's really formalize that and make it our narrative. We need something to counter the angry narratives that we've got of people who haven't been well served, who haven't been well cared for at the personal level or by policy. Let's call to what we actually all want. We want love. Let's start a narrative that is based around love, based around hope, moving towards well-being for all. And I think that not only do we have a better chance of having a better future, we have a much better chance of living a better day every single day, if that's really what we've got our eye on. So thank you very much for the opportunity to speak. I mostly speak here on behalf of my patients in the Arctic and on behalf of my daughters, Ellen and Vivi. Thank you.
very much, Cornelia, and keep with your Arctic and many other activities that you're putting in place. We need people like you, clinicians, so much motivated and committed. Let's now go